Dr. Redlener, when the president said again today, no one could have possibly imagined a situation like this ever coming to the United States. What was your reaction to that?
Well, having been very much involved with the development of such plans back in 2007, 2008, on a federal, state, and local level, it's a preposterous statement, has no bearing to reality, but, why are we surprised? I think the key thing is that we continue to get these mixed messages based on ignorance, a lack of understanding of the science, and just a complete misunderstanding of what the message should be to Americans. Problem is, he's using that kind of information to justify in some way or explain the incompetencies of what this administration has been doing or not doing in preparation for something that we knew was coming. And even when we got the early warnings, we still messed up the entire process of getting the appropriate testing done and distributed properly. And now we have mixed messages, which are just confusing states and localities. And the biggest problem of all, of course, is a complete active melting down of America's health and hospital system. It is staggering in its breadth and scope of incompetence. And, the president did not cause this virus to develop. The president is responsible for leading the country in the wrong direction with misinformation that has been extremely destructive to our efforts to combat this calamity that we have on our doorstep.
Nick Kristof, as you've been talking to the experts and reporting on this in the New York Times, have you found anyone who said that who's an expert in this arena who said they are completely shocked by this happening in the United States? They never dreamed something like this could happen.
No, of course, it's the opposite. And, I will back up what Irwin said. I've known him for many years, and he's been hounding me, as many other journalists indeed, to write about this risk, as have other epidemiologists, as have other national security people. This is a risk that we're all aware of. And we've also known the importance of getting personal protective equipment, PPE, in the hands of doctors and hospitals. We've known the importance of getting ventilators. I began writing about this in January when Wuhan was hit, and China gave us a 2-month warning that we squandered. And now I'm afraid New York City is turning into Wuhan.